It's always interesting when you see a market that's, really taking off, not just growing steadily, but really accelerating.
Mm,
And the vitamin D testing market seems to be exactly that. We're looking at figures like what? Nearly $1.1 billion expected for 2025?
that's right. And then potentially soaring to almost $2.2 billion by 2033. That's a compound annual growth rate of over 9%.
Yeah.
Quite impressive.
It really is. It signals something significant is happening. So for this deep dive, we're looking at a recent report, right, from March 2025.
Exactly. By Manoj Fagar.
Oh.
It's pretty comprehensive, looks back a bit, projects forward to 2033, gives us a good handle on the dynamics.
Okay, great. So our mission today is basically to unpack that. Why is this market booming? What are the key drivers?
Right.
Which tests are most common? Where's the action geographically? Let's dig in. So maybe start with the basics. Why are more people getting tested?
Well, the report flags the rising prevalence of vitamin D deficiency as, a primary factor.
Right.
There's just much more awareness now.
Awareness of the deficiency itself or the risks?
Both, really. People understand low levels can lead to problems, bone issues, sure, but also immune function, maybe links to chronic diseases.
Okay.
So naturally, if you hear about these risks, you think, maybe I should get checked. And it's not just less sun exposure, diet changes, better understanding of who's at risk. It all plays a part.
That makes sense. You hear about a potential health issue, you want to know where you stand, and it's not just individuals deciding this on their own, is it? Are healthcare systems pushing this too?
Yes, absolutely.
Hmm.
Government and healthcare initiatives promoting screening programs are definitely another driver mentioned, a more proactive public health approach.
Right.
And if connect that to demographics, well, aging populations are often more prone to deficiency.
Yeah.
Plus, more of us live urban lifestyles, maybe less time outdoors. So the pool of potentially affected people grows.
Okay, the indoor shift. And it's not just why people are getting tested, but how they're getting tested. The technology is improving too.
That's a crucial piece. Technological developments are huge. We're seeing tests that are more precise, faster, and easier to use.
Easier how?
Well, think about advancements in lab assays, the equipment. It means quicker turnaround times for results.
Which definitely helps. No one likes waiting ages for test results.
Exactly. And also, related to that, the report mentions point-of-care testing.
Ah, so testing outside the big labs.
Precisely. Being able to do tests in, say, a doctor's clinic or other healthcare settings makes it way more accessible.
Yeah, I can see how that would boost numbers, getting a quick test during a regular checkup.
It removes a barrier, for sure.
Okay, so we've got deficiency awareness, screening programs, demographic shifts, better tech, point of care. Anything else major fueling this?
Yes, there's also this broader trend of growing health consciousness. People are just generally more proactive about their health these days.
Oh, more engaged.
Right. And with lifestyle disorders on the rise, regular checkups become more common, and vitamin D testing is increasingly part of that panel.
Especially for certain groups, maybe.
Yes, the report notes the growing elderly population who might have chronic conditions like peripheral vascular diseases or diabetes that can affect skin integrity and vitamin D production. So higher risk, more testing.
Okay, that really paints a clear picture of the growth drivers. But is it all just smooth sailing upwards? Are there any, brakes on this growth?
That's a good question. And yes, the report does mention a restraining factor. It points to initiatives to limit the overuse of testing.
Overuse. How so?
Well, particularly in developed countries like the U.S. and Germany, there's a concern that too much repetitive testing adds to healthcare costs.
Ah, the burden on the system.
Exactly. So some places have brought in regulations or guidelines about how often tests should be done, and that has, slowed growth down a bit in certain areas, provides a bit of balance.
Okay, a check against potential overtesting. That makes sense from a system perspective. So moving on slightly, what about the key trends shaping the market right now? Are they mostly reinforcing these drivers?
Pretty much, yes. The rising awareness about vitamin D deficiency is highlighted again as a major ongoing trend. It's not just knowing it exists, but a deeper understanding of its role.
In bone health, immunity.
Right. All those functions. And this knowledge is being spread through health campaigns, media covering scientific findings. It keeps the demand simmering.
So the more we learn, the more relevant testing seems, and that probably links back to the other trend you mentioned.
It does. That growing health consciousness, it's a persistent trend, people taking charge, wanting data about their own bodies, including their vitamin D levels, as part of just, regular health maintenance.
Okay, understood. So we know why it's growing. Let's talk numbers and places. What's the global size again for 2025, and where's the biggest slice of the pie?
So the global figure for 2025 is pegged at USD 1086.68 million. And North America is the leader, holding the biggest share.
Oh, big.
USD 402.07 million. That's over 40% of the global market. And it's expected to grow steadily, CAGR of 7.6% through 2033.
And within North America, is it mostly the U.S.?
Yeah, the U.S. is the main player there, around $317 million. Then Canada and Mexico follow, each with slightly different but still strong growth rates, high awareness, established healthcare systems. Yeah. It all contributes.
Okay, North America leads. Who's number two?
That would be Europe. They're at USD 315.14 million for 2025, so over 30% of the global share. And their growth is projected slightly faster, actually, at 8.2% CAGR.
Which countries are key in Europe?
The report highlights the UK, France, and Germany. Seems there's a real focus there on detecting deficiencies early.
Interesting. Now, I remember reading something about Asia Pacific having really fast growth.
You're right. APAC is definitely the region to watch for growth. Their 2025 market size is about USD 260.8 million, around 23% share.
With the growth rate.
That's projected at 12.0% CGR, the highest regional rate.
Wow.
Yeah. Countries like China, Japan, India. India specifically has a huge CGR projection, almost 14%, and Australia are driving this. Rising healthcare spending, more awareness. It's a potent mix.
Okay, 12% is seriously fast. What about the other regions? South America, Middle East, Africa. Are they significant?
They're smaller markets, but still growing. South America is around $41 million, with a solid 9.9% CAGR. Brazil and Argentina are mentioned for tech advances and access.
Right.
The Middle East is similar in size, about $43 million, but slightly higher growth at 10.5% CAGR. Saudi Arabia and the UAE are key there.
Okay.
And Africa is the smallest currently, around $24 million, but still growing at 9.5% CAGR. South Africa is mentioned for increasing investment in diagnostics.
It's really useful seeing that global breakdown and the different growth speeds. Now, the report also slices the market in other ways, right? Like by the specific type of vitamin D test.
Yes, it does. And the 25-hydroxy-D vitamin test is expected to dominate. That's kind of the standard one.
Why is that?
Because it measures the main storage form of vitamin D in your body. Gives a good overall picture. So it's used a lot in routine checks and for diagnosing general deficiency. Think of it as checking your reserves.
Okay, the main storage measure, is that the only type?
No, there's also the 1025-dihydroxy-D vitamin test. And that segment is actually pegged as the fastest growing, even though it's smaller overall.
Why would that one be growing faster?
It measures the active form of vitamin D. That's more relevant for specific things like diagnostic issues with calcium absorption or certain bone diseases, more specialized perhaps.
Ah, okay. So storage test is common, active test is growing fast for more specific diagnostic needs.
Got it. What about the lab techniques used?
Right. Technique-wise, radioimmunoassay RIA apparently still holds the largest share currently.
But I sense a but.
Well, the report notes it can have high variability. It's not always perfectly consistent.
Okay. So what's gaining ground?
LC-MS/MS techniques. Liquid chromatography tandem mass spectrometry.
Sounds sophisticated.
It is, and it's expanding rapidly because it's much more accurate, especially for measuring the different forms, the metabolites, of vitamin D.
Why does that level of detail matter? It's crucial for really understanding the type of deficiency someone has. That way, any supplementation or treatment can be much more targeted and effective. The report even mentions a specific kit from Immune Diagnostic using this tech.
So precision is driving the shift towards LC-MS/MS, even if RIA is still common. Makes sense. The report also mentioned a component split. What's that refer to?
Yeah, component here means the patient group, so adult versus pediatric.
Okay, and the split.
The adult segment has the largest share. That's not too surprising. Routine checks, bone health concerns like osteoporosis in later life.
Right.
But the pediatric segment is flagged as rapidly growing. Testing kids is really important for tracking growth, diagnosing rickets, making sure infants get enough.
Especially those potentially at risk.
Yeah.
Crucial. Okay, and indication, the reason for the test.
Under indication, osteoporosis has the biggest share. Vitamin D is so vital for calcium absorption, bone density. Testing is standard practice there.
Makes perfect sense. And the fast-growing indication, is it rickets, tying back to the pediatric growth?
Exactly. Rickets is a rapidly growing sector here. Since vitamin D deficiency is a primary cause, testing is absolutely key for diagnosis and managing treatment in kids.
So bone health across the lifespan is a massive driver. Okay, last breakdown, end user. Who's actually doing the testing?
Hospitals hold the largest share. Testing is often just integrated into patient diagnosis and treatment plans within the hospital system.
Standard procedure.
Right. But interestingly, diagnostic laboratories, the specialized labs, are noted as a rapidly growing sector. They get referrals, offer dedicated services. Their role is expanding.
Okay, so hospitals lead, but specialized labs are catching up fast. That covers the market structure really well. What about the companies involved, the competitive landscape?
Yeah, the report calls it highly competitive. You've got big global players and smaller regional ones fighting for
Yeah.
share.
Any names mentioned?
Sure, companies like Diasorin, bioMérieux, Siemens, Quest Diagnostics, Danaher, they're highlighted for their product range and innovation.
The big names in diagnostics.
Definitely. And the report also mentions a couple of specific recent things, like Life Labs introducing a new, more automated vitamin D measurement method back in February 2022.
Improving the process.
Yeah, simplifying sample collection too.
Yeah.
And also a UK government program from April 2022 aimed at boosting vitamin D intake, which could indirectly drive more testing down the line.
Interesting. It really does sound like a dynamic space.
Yeah.
Okay, so if we were to boil this all down, what are the main takeaways from this deep dive?
I think the clearest takeaway is just the sheer scale of the projected growth. It's significant. And it's really driven by this dual engine of rising awareness of deficiency on one side and better, more accessible testing tech on the other.
Right.
We also saw the 25-hydroxy test is still the workhorse. Hospitals are the main end users for now, but diagnostic labs are growing fast. And geographically, while North America leads, keep an eye on APAC for that rapid growth.
Absolutely. So, thinking about all this, the prevalence of the deficiency, the easier testing, it does make you wonder, doesn't it? What are the bigger implications here for, like, preventative health? Could regular vitamin D testing become just standard practice, part of everyone's routine health maintenance in the future? It's an interesting thought, finding that balance between being proactive with testing and avoiding, unnecessary healthcare burden. It's something to mull over.
Yeah.